One would be, if possible, to address stress. Just recognizing it is important. Sometimes you can do things that decrease that, and if you do, your pressure is going to be better. We're super well designed to deal with intermittent stress. We're wired that way. But the day in and day out stuff, whether it's a family tragedy or a terrible work situation or something, those will grind you down. So that's one, if you can. And sometimes real simple things work for stress. Like, for instance, taking a 15 or 20-minute walk. And exercise, like I say, just needs to be convenient and enjoyable. And that can bring pressure down, and I think it's by stress reduction. Because when you're walking or doing any form of exercise, you're not thinking about all these things. It sort of takes your mind off of it. I'm not any good at this, but it's worth mentioning. Some people are quite good at meditation. That takes practice, but it's a wonderful thing to at least consider. There's a lot of breathing and meditation involved in yoga, for instance. So these are all non-drug things that are simple. Every now and then, pressure can be related to weight. That is actually a harder thing to alter. One of the things that we've found is often effective and is very easy is just to have people eat in a shorter window of time. When you're asleep, you're burning your fat. As soon as you put anything in your mouth, you stop. If you get up in the morning and you don't eat breakfast until noon, well, you've just extended that fat burning by 5 or 6 hours. And that works. That's actually surprisingly effective. Other things can work, but they can be more difficult as far as weight goes. So, stress reduction, exercise, weight sometimes. This is another one that's commonly done. It has some truth in some people. I'd say 5% of hypertensive people will have a benefit by decreasing the salt intake in their diet. And it's been preached to be the big, oh my, it should drop everybody's pressure. It doesn't. Most people handle salt fine. They could eat a ton of it, and it's not going to change their pressure. But there are exceptions. And usually, and that's something that needs to be done gradually, because food will taste terrible if you change things too fast. But salt reduction is more likely to work in people who tend to retain fluid.